Perfect. Good morning, everybody. Thank you so much for joining us on this lovely morning. The sun is finally out, and hopefully after yesterday, we won't have any more snow. That was quite a surprise and miserable. This morning's topic, we're going to be talking about access to services for some of our juveniles and children that we work with or that you may come across with. If at any point you have any questions, I believe Tricia will be monitoring the chat box, so feel free to enter your questions there, as well as we should have some time at the end to go over any questions that may have come up throughout the presentation. We'll start with some introductions. My name is Ashley Sansom. I work for Oakland Community Health Network. I'm the Mental Health and Juvenile Justice Coordinator here at OCHN. I'm a licensed master social worker and have worked with children since the beginning of my career in numerous settings, including home-based, as well as a trauma therapist, and then moving into my role here. I work with our youth in Oakland County in a variety of settings, including the court, the schools, as well as numerous families that I may come across throughout the community. I will hand it over to Jasmine. She will start it off this morning. I will let her introduce herself, and then we'll get going with the presentation.
Thanks, Ashley. My name is Jasmine White. I am the Access Supervisor for Oakland Community Health Network. I'm a licensed professional counselor, and I'm also certified as an advanced addictions counselor. So I've been working with all different CMH populations for the last 12 years. I really enjoy it. So we're really looking forward to sharing all of our information with you today. We will get started. Can you go to the next slide? Great, thank you. So we're going to start just talking a little bit about who we are at Oakland Community Health Network, or OCHN. We are the public mental health system for Oakland County, which is often referred to as the safety net. And also we can be known as CMH, Community Mental Health Authority. Those are all different synonyms for who we are. We're community-based, we're a local public entity, and we manage the specialty support and services to a multitude of people. Folks with serious mental illness, serious emotional disturbances, adults and children with intellectual and developmental disabilities. We service infant mental health populations, as well as adult and children with substance use disorders. Next slide. So our mission statement is very simple. We inspire hope, we empower people, and we strengthen communities. And that's really what we strive to do in our work on a day-to-day basis. You can see that we serve a very large amount of people, about 26,000 people in Oakland County. And if we break it down into those populations that we talked about just a minute ago, 12,700 are adults with mental illness, which is the greatest population that we serve. We have 340 people with autism spectrum disorder, about 2,400 children with serious emotional disturbances, 4,200 with intellectual and developmental disabilities, and 7,300 with substance use disorders. Next slide. So as I mentioned earlier, we are known as the safety net, and we are also what's called a PIHP and a CMHSP. It can be very confusing, so I'm going to break it down a little bit. PIHP stands for Prepaid Inpatient Health Plan. There are 10 in the state of Michigan. A few years ago, there used to be many more, and it was taken down to only 10. There are 3 counties that are CMHSPs and PIHPs, and those are Oakland, Macomb, and Wayne. So we're the largest counties, we serve the largest population, and we are PIHPs and CMHSPs. So PIHP is basically an organization that manages the Medicaid services related to the behavioral health, developmental disabilities, and substance use disorders services. We're contracted with the state, so MDHHS, and we are also responsible for arranging inpatient care for individuals in that region. Community Mental Health Service Programs, or CMHSPs, provide services and supports to people directly or through contracts. In Oakland County, we do a few services directly, but a lot of our services are directly through contracts with core providers. We're governed by a board of directors, and the CMHSP is managed by the PIHP. So Oakland, Wayne, and Macomb have one entity that is their PIHP and CMHSP, whereas other counties might have a different regional entity that manages their contracts. We are accountable to government entities, so we ensure that people served and public participation is allowable in our system's decision making. So we are always looking for the people we serve to tell us what's going well and what they need. All of our money that we save gets reinvested into the system. We're not for profit. And so that's kind of some of the differences between our public system and then the private health system. You can go on to the next slide, please. Okay, so this is a map of Michigan. You can see on the left, the left side are the CMHSPs. There are 46. Many of them are single county CMHSPs. And then on the right is the PIHP map. So you can see which counties kind of go together to make those regional entities. So for example, Region 1, which is North Care, is the Upper Peninsula, and you can see all the counties that are made up. So that one regional entity serves all of those counties, and they manage that. And then at the bottom here, Region 7, 8, and 9 are Wayne, Oakland, and Macomb. And so we're one county which is the PIHP and the CMHSP. Some of the PIHPs are very vast. Region 5, for example, is massive and in the middle of the state, but Oakland County still serves more people. You can go to the next slide. Thank you. So it's important to understand how funding and service delivery works. So you can see that first of all, we get funding from MDHHS. Okay, so it comes to Oakland County. OCHN has the funding. We send money to our core providers who service people. We also pay our direct service providers, CLS workers, respite, skill building, and then those services go down to the people. So everything that we do is focused on the people that we serve. One of the things that's important to understand is also that we do get some local funding from the county. That is generally, we use it for jail programs and other county initiatives that support the people we serve. So we partner with the county to be able to do that. Next slide, I believe now I'm going to give it to you, Ashley.
Yeah, so I'll kind of jump into things here. We're going to start off talking a little bit about stigma. I think the purpose of these webinars is relating to the purpose as well. We all come from different backgrounds and different professions. And to kind of link that, I think that's important to mention here that we all use various language. And part of these webinars, we're focusing on sharing what we're using in the CMH language so that we can better serve all the people that we may have cross-collaboratively serve. So once again, we all use different language coming from different backgrounds, different professions. The important thing is to recognize that if stigma is placed on a child or a family, they're going to be less likely to reach out for help. So one of the things that OCHN did was launched a campaign to kind of help change language that is used in the community. So you'll see on the right-hand side of the screen there, it says people who have bipolar disorder instead of saying, oh, well, she's bipolar. You can see how that kind of can be a negative connotation and kind of discourage someone from seeking out treatment. So overall, using some more person-first language so that we can really help encourage a lot of these families to get into services, whether it's adults or children. Some of the definitions that you'll see that we're using here in the CMH world, or that maybe you've heard frequently, is serious emotional disturbance. You may also hear that referred to as SED. We use lots of acronyms. If for any means you ever hear an acronym you don't understand, please always stop and ask. SED refers to individuals under the age of 18. That's really important to recognize that the SED terminology is only used for children. It's not used for adults. It's a diagnosable mental, behavioral, or emotional disorder within the past year. It substantially interferes with the child's role or functioning in family, school, or community activities. You may also hear mental illness, which is a condition that affects an individual's mood, thinking, feeling, or behavior, and causes distress or difficulty performing their usual functions. Substance use disorder, you may also hear that abbreviated as SUD. You may have had children that you referred to or adults that you referred to an SUD assessment. That's referring, or an SUD screening. Those screenings we do over at Access. But it's a disease that affects a person's brain or behavior and leads to an inability to control the use of legal or illegal drugs or medications. With all the definitions that you see here, you realize that the person's environment is impacted. For children, we're a lot of times looking at, they have sort of two main environments, the home and the school. So they're having some pretty significant difficulties in some of those environments. It could be all of their environments or one of them. And they're having, like I said, significant difficulty that's causing them to have some impact in functioning. So, for example, you may see lots of suspensions from school, running away behavior from the home, aggressiveness with peers. Something is interfering with their functioning that they're not able to complete their roles. So these are some of the diagnoses that maybe you may have heard of as we're talking about mental health. They're listed there on the screen. I wanted to take a minute here too and pause to think about that often mental health is referred to as a bad or negative thing. You often hear that, oh, that person has a mental health diagnosis, and it's kind of referred to as a negative thing. But we can also talk about mental health in a positive way. How do we take care of ourselves? What are we doing to take care of our mental health? Especially when we're going through a difficult time that we're kind of experiencing now in our society, thinking about we have to take care of our mental health on a daily basis so that we can be the best people that we can be, and serve our communities in the best way possible. So thinking that mental health is just not a negative thing, it can also be talked to about and should be talked about in a positive way. So thinking about our development in school-age children and teens, I broke this down to school-age children, young teens, and teens. I think there's a pretty significant difference between our young teens and teens. Thinking about 7th and 8th grade and then thinking about a 11th or 12th grader, you can see there's some pretty dramatic difference. So I broke it down. As you can see, I won't read the entire slide, but the age bracket is underneath each column and broken down. It's really important to know and understand the development of our children and adolescents, so that if we realize that a disruption or a change is occurring, we can recognize it and help it. I'm a little bit of a nerd and really like brain development. So there's lots of different studies out there about when does the brain actually development or is actually fully developed. And thinking about that, most studies are saying it's about age 25. Um, so a lot of times people will say, how many times have we said to a child or a teen, well, how come why did you not think about that before you did it? You should have thought about that before you did it. Um, and a lot of times their brains are not fully developed enough to really fully examine consequences, choices, actions. No, not that that should be an excuse, but a lot of times kids are seen as impulsive. But a lot of times it's not that they're impulsive, but just that their brain is not fully developed to that capacity yet. You sort of have to think of the brain as a bottom up kind of development. And the frontal lobe is the last to fully develop, which we know the frontal lobe is in control of our reasoning, thinking. So that's why a lot of times that we don't see that fully rational thinking with a lot of our teens. So if we're thinking about what should be appropriate, we also have to talk about what may be some potential warning signs for our kids. Now, it would be impossible to list every single warning sign. So some common ones are listed here for all ages. It's important that warning signs can kind of cross ages. What I really want to stress here is that people who are working with the children and who see them every day, their parents, caregivers, teachers, even, as far as if they're on probation, probation officers who are regularly checking in with them, um, their therapists, um, they know those children the best. And It would be impossible to keep track, like I said, of every potential warning sign, but you know those kids so well that you're able to recognize, okay, that's a little odd that little Johnny went from receiving all A's to now he's getting D's and E's. What is going on with him? So paying attention and really paying attention to our kids so that we can recognize when these changes are occurring is really key. And I can't tell you how many times I've worked with kids who say, nobody ever has asked me if I was feeling that way or if I was okay. I went to school every day. I seen my teachers every day. I was seeming withdrawn. They didn't notice the cuts on my arm. Nobody ever stopped to ask me, hey, are you okay? So I think it's really important too that as we're working with kids, they know themselves best. And if you have a trusted adult in their environment, ask them, are you doing okay? Is everything okay today? Because that simple little statement can open up a huge door for kids. Making treatment available to those kids. You're a trusted adult, now they opened up, and now we can really get them the help that they need. So they know themselves best, and I think asking kids is really, really important and that we shouldn't undermine that at all. Um, Here's a little slide on HIPAA and 42 CFR. What's really important to remember is that as individuals are going through treatment, they have the right for their treatment to be protected, meaning that they are not required to share any information with individuals that they do not want to share with. So a lot of times we have to have a release of information. So you may hear that throughout as you're working with different providers. If you're calling and saying, hey, I need to know if little Susie is going to counseling and if she's making progress, they may respond with, okay, let me get back to you. I need to get a release of information first. So just checking with those individuals to make sure that it's okay that they share that information. What's really important is to remember that 42 CFR is in relation to substance use and substance use treatment. It was specifically designed so that individuals could seek out treatment for substance use without having stigma and really encourage individuals to seek out treatment for that without having to feel like all of their information was going to be divulged or anything of that nature. One thing to really highlight here is that with 42 CFR, we have to have a written release on file. With HIPAA and mental health, we can take an oral release or a verbal consent, but with 42 CFR, it has to be written. So keep that in mind as you're seeking information out from providers, or if you're wondering if an individual is going into treatment, that written release of information has to be on file for 42 CFR. Some of the services that we offer through the community mental health system for children. So we'll get into that. I'm going to break it down. One of the main things is therapy. We have outpatient, which is typically what you would think of as the individuals going to the office, maybe on a weekly, every other week basis, sort of what you would kind of imagine your typical therapy as. We also have our home-based services, which is a little bit more intensive. And with home-based, the clinician may go out to the child's home or see them at school, as well as the hours of therapy tend to increase with home-based therapy. And these can be a little bit more of our intensive kids that we have. We offer psychiatry, so for those kids who need medication or need to be monitored on medication. As well as wraparound. And wraparound, we contract with Oakland schools. So if you're working with some kiddos and you get contacted by Oakland schools, they have our contract for our wraparound services. And wraparound is really working with all the different systems in the community. So if you have a child who's involved maybe with school and court and the family, they're really working with all of those systems to really bring together that team to really serve that kid as best possible. It is very strength-based and very family-based. So once again, if the family's not interested, this may not be the best service for them. We won't force them. It would have to be something that they wanted and initiated, as well with all of our services. Community living supports is really helping a kid kind of prepare some of those skills. So they may be working on meal prepping, budgeting, they may be engaging in some recreational activities, really developing the child's skill set so they can be more independent. Respite can be in home or out of home and is designed for children. As we know, some of these kids have very, very intense needs. So it can be a 24-hour, 7-day a week job for some of these caregivers. And we don't want them to get burnt out so much that they want to remove the child out of the home. So respite is really designed to give those caregivers a break. Peer supports. Individuals have a sort of a young adult who's there to kind of guide them through, increase some of their independence. Once again, increasing their skill set, and working through some of their, working towards some of their goals. Parent support partner is designed to be another support to those caregivers and parents that are in the home, whether that be a guardian or a parent. And these are parents who have all had children who have went through the mental health system. And they're trained and there to help parents with engagement in services, walk them through some of these processes, and just be there as an additional support for them. It may be a process to enroll in some of these services. However, if a child is already engaged in services, if they already have a therapist, the families can talk to that therapist about adding additional services. All of our services are bundled. So a child may be receiving several services. They could be receiving all of these, a couple of them, but it's important to remember that a child would not just be receiving respite. They would have a combination of services, or they would not just be receiving psychiatry. I get that question a lot. They would have to engage in sort of a bundled of service. The purpose of CMH services is really to keep kids in the community. We want to offer a variety of intense services so that we don't have to hospitalize children or put them in residential settings or remove them out of the home. We really want to do our best to keep kids in the community. You may have heard of something called the SED waiver, so standing for the Serious Emotional Disturbance Waiver. Anybody can apply for this waiver regardless of their insurance status, and it is a contract or collaboration between OCHN and MDHHS. This waiver is really designed for our most severe children. They may have had lots of hospitalizations. They may have not been successful in treatment before. They have some pretty significant mental health diagnoses. These are our most severe children in the county. There is some eligibility requirements as far as that they must be a child under the age of 18 and live in Oakland County. Autism cannot be the primary diagnosis. So for example, you may have a child who is diagnosed with oppositional defiant disorder as their primary diagnosis, but then also be diagnosed with autism spectrum disorder as a secondary diagnosis. That would be okay. However, if the child is diagnosed with autism as the primary diagnosis and maybe anxiety as their secondary diagnosis, that wouldn't necessarily work for the SED waiver. And once again, they must be at risk of hospitalization, or maybe they've had a history of hospitalizations in the past. What kind of differentiates the SED waiver is that the available hours are going to increase. So that means more respite hours, more hours. So once again, that we can decrease that risk of hospitalization for the child. SED services, we use a tool called the CAFAS, which some of you may be familiar with. It stands for the Child and Adolescent Functional Assessment Scale. So it kind of determines what level of care is necessary for children. We use the CAFAS at the time of doing an access screening, but then once again, the CAFAS is used at multiple times throughout treatment. So once again, it would be done at intake as well as they're given every 3 months. And so if CAFAS scales are going down, then we know that maybe we can decrease the level of intensity. If CAFAS is going up, then maybe we know that additional services may be needed or that we need to increase the intensity of services. I'm going to hand it back over to Jasmine to talk a little bit about our IDD and SUD services.
Thank you. So it's important to note that our fourth webinar is really going into detail about access to services and those processes. So I'm going to briefly talk about what we have to offer and some of the requirements, but I'm not going to get too in depth with that because we are going to talk about it at our last webinar. So our intellectual and developmental disabilities, these are disorders that are generally present at birth and negatively affect the trajectory of the individual's physical, intellectual, and emotional development. In most cases, anyone that has an intellectual developmental disability would start to have that prior to the age of 22. Anything that happens after the age of 22 is not considered to be an intellectual and developmental disability. I mean, it's still considered, but in terms of services for Oakland Community Health Network, in order to get services for these populations, you had to have this developmental disability prior to 22. So some examples, as Ashley mentioned, autism spectrum disorder, Down syndrome, cerebral palsy, traumatic brain injury. People can get TBIs at all different times in their life. However, it still has to be prior to the age of 22 to be considered as able to get services through Oakland Community Health Network. Fetal alcohol syndrome is also considered an IDD. Next slide. So in terms of intellectual and developmental disabilities, there is quite a process to getting services. We do require that the individual or their legal guardian call and request services, as all services are voluntary. We have staff that answer the phones, and we'll be asking some specific documentation requirements. We're really going to be looking at some diagnosis paperwork. We do look for IEPs or METs that you might get through the school system. And then if there is a guardian in place, we would like guardianship paperwork. Once we get the paperwork in place, there is some eligibility that will be determined by an access screener. And we're really looking for the individual to have substantial functional limitations in certain areas of their life, which we'll go into more detail at the next webinar. That screening is generally face-to-face, and it takes anywhere from 1 to 2 hours. If they are considered eligible, they will be given an appointment immediately with a provider within 14 days, and it'll be scheduled and they'll be all set up. If they're not found eligible, we will give them some resources and link them to things in the community near their home that might assist them. We do also do IDD services for the little ones. For those that are very young, we do infant mental health services, but there are some kiddos that have these developmental disabilities from a very, very young age and are diagnosed immediately or in the first few years of life. It is important to note that a lot of the little ones are not able to be diagnosed right away. They might have something like otherwise health impaired or borderline intellectual functioning. In most of those cases, we do encourage them to be assisted through early on in the schools prior to getting screened for IDD services, because really we don't know what's going on with that kiddo, and those the school can really help with that. And then as they start to go through school, we might be able to get that diagnosis in place so they can have these services. We also offer ABA, which is Applied Behavioral Analysis for Autism Spectrum Disorder. That is also a slight process in terms of requesting those services. That requires some paperwork, but again, you call access, and what's going to happen is you will get what's called an MCHAT or an SCQ. Those are standard screening tools for the autism spectrum disorder. After having that conversation with the screener, then you're referred to our diagnosticians for an ADOS. And that is really a really long assessment that they do face-to-face. It's very play-based to really determine if your child is eligible for the benefit. They're not diagnosing kiddos with autism. We really like the kids to come in with that diagnosis or with some documentation from a doctor or the school or provider that says we have concerns about autism, because that assessment is really to see if that child will meet criteria to be in the benefit. The benefit is pretty significant. You can get anywhere from 15 to 25 hours a week in just the applied behavioral analysis. And that's for kids 0 to 21. They expanded that a couple of years ago. So up to the age 21, you can get that benefit. You can do that in conjunction with intellectual developmental disabilities or SED services. So we're really not limiting that. It doesn't matter which service array you're in. You can have both, or you can do only applied behavioral analysis. A lot of times families are very overwhelmed and they might just want to stick with ABA only. So they would be connected with a provider for support coordination, and then they would be able to choose one of our ABA providers to do that work. And that can be done in the community or in the structured setting of the provider, or they can also do it home-based. So there's a lot of different options for ABA. One thing it's important to note is that all of the services, mental health services that we're talking about today, are Medicaid-based. So folks with Medicaid or private insurance with Medicaid would qualify. If you have no insurance, we have a wait list for services, and we also would link those individuals to community providers. We have some providers that can do lots of great work with individuals without insurance. That is different for the Substance Use Disorder Network. They have a lot of different funding sources, and so privately insured, Medicare and Medicaid can all be seen through substance use disorders. But for mental health, Medicaid is the primary payer. Okay, I think let's go on to the next slide. Providers. So our intellectual and developmental disability providers we have two of those. We have MORC, Macomb Oakland Regional Center, and we have Community Living Services, or CLS. We also have a very long list of autism benefit providers, and that can be found on our website. It was way too much to list in here, but you can go to the website and there are links to all of their different websites. For children with serious emotional disturbances, we have Easter Seals Michigan, Oakland Family Services, and Arab American Chaldean Council. And then for adults with mental illness, we have, again, Arab American Chaldean Council, Easter Seals Michigan, CNS Healthcare, and Training and Treatment Innovations. These providers are all over the county. Many of them have multiple locations. Many of them do all home-based services and can assist with transportation needs and things like that. So, especially depending on where you live, you don't have to choose only the provider that lives in your, that is in your city. You can go outside of that. You have choice of any of the providers in our county, and they will work with you. Also to note, MORC, Easter Seals, Michigan, they are also ABA providers, and Training and Treatment also has ABA services along with adults with mental illness services. Okay, next slide. One thing I do want to mention before I move on to substance use, it's important to note that when a person comes through Access and they're looking for services, we are looking for which population designation is their primary. So as Ashley mentioned, for example, with SCD waiver, you may have a serious emotional disturbance and then autism. Autism is can be serious emotional disturbance. It can also go with the IDD network. So we're really looking at what is the best fit for that child or individual that comes in, because you cannot be in two designations. All of our providers are co-occurring capable. So if an individual has autism, they can still be seen at Easter Seals or Oakland Family Services and be successful. We're looking at the primary diagnosis for what the best services are to suit them. Okay, thank you, sorry. Okay, we're gonna move on to substance use disorders, and Trisha, if you do have the brochure and you could share that, that would be great with the group.
I will do that.
Thank you. It's important to note that substance use disorder service providers are all co-occurring capable as well. So they can serve folks that have mental health disorders, and vice versa. All of our CMH providers can serve folks with substance use disorders. Again, it's really looking at what are their needs. So if their substance use needs are primary and are more, that they may go to a substance use disorder service provider, and vice versa. If they have some mental health issues that are primary, they might go to a CMH mental health provider. For children, we have a few different services that are offered. Outpatient services are generally 6 hours or less per week. They're looking at recovery or motivational enhancement therapies and strategies. They have a lot of different settings. They do have groups and things like that. Then we move into intensive outpatient services. Oakland Family Services offers this to kiddos at Children's Village as well. So that's important to note. If they're at Children's Village, this is something that is offered to them, and that they do go off-site to OFS to have this treatment. This is 6 or more hours, focusing on multidimensional instability. And they're also capable of meeting the complex needs of the kiddos with addiction and co-occurring conditions. So they're going to address mental health issues as well. But their intensive outpatient services are really going to be focused on SUD as primary. Next slide. Okay, we also do offer residential treatment. This is 24 hours with trained counselors. They're going to stabilize the individual from imminent danger, and then they're going to prepare them for transitioning down to outpatient treatment. There are designated addiction treatment, mental health, and medical personnel there, because obviously residential has, there's a medical piece there. They need to make sure that, everyone is healthy and that they're focusing on that addiction treatment in a closed setting so that they can prepare them back into the real world for outpatient services. Next slide. Okay, access is the place to call for the front door services of Oakland County. If you're looking for any high-level substance use disorder services, detox, residential, intensive outpatient, or if you're looking for any of our mental health or intellectual and developmental disability services for CMH, you do need to come through Access. For outpatient services for substance use disorders, you can call those providers right away. You don't need to come through Access. And I know Trisha's sharing the brochure. It's also on our website. But if you're looking for the higher level substance use disorder or the CMH, mental health, and IDD services, you need to call Access. The phone number is right here. We're open Monday through Friday. We do have a couple late nights where we do see generally, obviously not right now with COVID going on, but we generally see folks as walk-ins through 8 p.m. on Mondays and Thursdays. And we have screeners and referral specialists that are working. So if you prefer a phone call, we can do that as well. We are at the Oakland County campus on Telegraph. We are in the same building as Common Ground. However, we are sort of separate entities. So when you walk in, you'll see our sign. You see the walk-in hours there. It is always best to call simply because we're like an urgent care. If we're very backed up, you would have to wait. But if you call, we might be able to offer you an appointment time sooner. You wouldn't have to sit there all day. So please, if you have any questions or need any of the services, give Access a call. We are currently open, still doing screenings. If you're not sure what you need, if you're not sure about your insurance, if you need any other community resources, please call our number. Staff have a variety of community resources, and we can give those to you as you need them. So don't hesitate to give us a call when you need us. The only other thing I want to mention is if there is guardianship or adoptive paperwork, we do need that in place in order to move forward. We have to have those things, legally we need to make sure that we're following that and we're following HIPAA and 42 CFR. So that is important to know. We also do have screeners that are embedded in the circuit court, the family division. Ashley mentioned her role a little bit. We have a couple different screeners in different locations in our community that are also able to assist you. So if you're not sure where to find them or who they might be, you can also call our main number. And Ashley, I believe it's back to you.
Yeah, as Jasmine mentioned, I am, both Amanda and myself are at the circuit court, assisting juvenile caseworkers there, as well as some of our reentry specialists over at Children's Village. So our contact information is on the last slide. So if you have any questions, you can reach out to us there if it is related to youth or somebody of that nature. Just a couple community resources here. We do have the RISE Center, which is in the same building as both Access and Common Ground. They are extremely helpful. So if anybody has families that need assistance, feel free to send them over there. They do take walk-ins, or they can call and schedule. I refer a lot of families there who maybe need help applying for Medicaid or have questions about their Medicaid of that nature, but they can help get families connected to a variety of resources there. As far as our crisis services in Oakland County, as Jasmine mentioned, OCHN and Common Ground are in the same building. However, we are two separate entities, but we contract with Common Ground to provide the crisis services for Oakland County. So anybody who has Medicaid or no insurance and needs a higher level of care, for example, they may need inpatient or a partial program like face-to-face, they have to go to Common Ground to get that evaluation for the higher level of care. You'll see at the top that that is Common Ground's crisis line, 24 hours, 7 days a week. You can call. There's also a chat feature on their website that, or a text feature that if for any reason a young person's not comfortable calling, there's multiple options. We have Oasis and Ochre. And then as there's the other services are listed here as well: Victims Assistance, CRU, Legal Clinic, the Sanctuary, and Sober Support Unit. I did want to mention the Sanctuary because that is the shelter for youth in Oakland County. So if you do have a youth who needs temporary shelter up to 30 days, they could contact the Sanctuary to stay there, where they can be provided housing as well as some services and treatment while they're staying there. We do also have the mobile crisis team, which is a really, really awesome service. We contract with New Oakland to provide this service. It is for children who do have Medicaid. However, I always encourage that if you have a question or you're not sure what to do, it's another resource that you could call. They do come, so for example, a family would call, and if there's a crisis going on, they can come out to the home. They come in teams of two, a social worker as well as a social work technician, and they try and de-escalate the situation. The purpose of this is so that children don't have to go to the hospital or call the police or etc. We want to keep kids in the community. We don't want to have to take them out of the home. So if a clinician can come out and de-escalate the situation and it's a safe situation for them to do that, they will do that. I have heard from some of our caseworkers that we work with that this is a really good service for some of our kids who are on probation. Because if it is a mental health crisis that is going on and mom or dad call the police and the police respond, that could be considered a violation of probation. So we want to make sure that we're giving the right resources to individuals. If it is a mental health crisis, they can call the mobile crisis team. They are an after hours service, so they are 2 to 10 p.m. 7 days a week, and that includes holidays as well. We know during holidays that crisis I don't know if that's a word, but can escalate. So there tends to be an increase in crisis during holidays, especially during a time right now when kids are home 24 hours of the day. That can create some tensions in the family. So feel free to provide these resources to any families you may be working with. This is our customer service line. Another number that's good to have. If somebody's having a problem with services that they're receiving, they want to switch providers, or anything else of that nature, they can call the customer service line. Once again, that is a business hours line. And then, as I mentioned before, this is my contact information. Our main number is on there as well, just in case access or customer service couldn't help you. You can also call the OCHN main number. Amanda and I are embedded at the circuit court in the family division. As I mentioned before, we also are out and about some days of the week at schools. So if you have any questions in relation to a youth, access to services, you can feel free to contact me, email or phone, as well as if you aren't able to get a hold of me, you can contact my coworker Amanda as well. We do share roles. Trisha, I'm going to hand it over to you to see if we have any questions or if people want to ask any questions, they can take themselves off mute.
All right, thank you. Great job. I had no questions so far in the chat, so you can either unmute yourself or use the chat if you have any additional questions. If not, I did provide a few links in the chat to our OCHN provider directory, our SUD brochure, and also the link to register for the 4th webinar in this series, where we dive more deeply into how to access the services. We'll also be posting this recording online, and you should receive an email with a link to be able to view that. So I will give it a couple minutes, but I don't see any questions online. So with that, I am going to stop the recording.